And NRG1, these are very rare tumors. These are generally only found with RNA sequencing. These are seen across multiple cancer types. Here's some data we presented at ASCO about what tumors we find them in. It's a big tumor, a big gene rather, and so you do need to use RNA sequencing to find it. It's a complex physiology, but basically NRG is a ligand that binds to HER3. HER3 then binds to HER2, and then we lead to signals that propagate growth in cancer. And when we have an NRG1 fusion, it keeps that NRG1 really close to the HER3. So it's constantly signaling for growth. And that's why these NRG1 fusions can lead to cancer. And how do we block that? Well, we can block it primarily by interfering with the HER2 pathway. This is a registry that we led. Dr. Nagasaka was a part of this, looking at NRG1 fusions in lung cancer. What we learned is that these tumors do not respond well to treatment. If we look at a combination of chemotherapy and immunotherapy, for example, the response rate was 0. And so the standard treatments do not work well for these cancers. There are no approved drugs yet for NRG1. Afatinib is a drug we use for EGFR that blocks HER2 signals, that has shown responses, some shown here, generally cases. And so it's hard to know exactly how well it works. Seribantumab is a HER3 antibody that did show response rates of about 33%, but this drug has been discontinued and is no longer being investigated. The only one left in trials is zenocutuzumab, and that's a bispecific antibody in the NRG1 study that binds to HER2 and HER3 to block signaling. And we've seen in early results a response rate about 34% overall and in lung cancer, with relatively few side effects. A very well-tolerated drug, but not approved, currently FDA Fast Track designation. So to summarize here, when a fusion's there, we've got to find it to choose the right treatment. RET and NTRK are both actionable with approved drugs. NTRK has some unique side effects to be aware of during and after treatment. NRG1, if we see one of these fusions, we got to get to a trial in a hurry because the standard treatments do not work very well. And for all of these, we expect trials to really be the future for how to manage these unique rare events.